See the subcision. See this. I'm putting a needle inside. You ought to see the needle from upwards. See that needle movement? As you are able to see the needle? See the needle, then go around. Fan around, fan around, fan around, fan around, fan around, fan around. After doing a subcision, after cutting the fibrotic cord, there will be a small crackling sound when you cut it. That indicates that the fibrotic cord is cut. You can go deeper, you can cut the fibrotic. See that now? See now, everything is coming up. Everything would have become softer. Previously, everything, whatever was fibrotic, when you cut that, it becomes softer. But be liberal, be hard. Be hard, be hard, nothing happens. Don't worry, don't worry, don't worry. This is subcision. The gap between subcision and microdermabrasion or dermabrasion should be at least 15 days. Give a gap of 15 days. Why we give a gap of 15 days, 30 days, 6 months in any cosmetic procedure is to allow the epidermis to grow. The epidermal turnover time is 28 days. The dermis and epidermis put together, the turnover time is in and around 50 to 70 days. So, you go in for a dermal lesion, we have to give a gap of 2 months. You go in for an epidermal rejuvenation, you have to give a gap of 15 to 28 days. After 15 days, we can go in for dermabrasion, we can go in for a microdermabrasion. The gap between microderm and one microderm, which should be 15 days. The gap between one dermabrasion and another dermabrasion should be 15 days. A gap between one fractional CO2 and the other fractional CO2 is to be 15 to 28 days. As I told you, after surgery, 2 days steroids, topical steroids, followed with hydroquinone for 15 days. After that, after finishing off the procedure, you can just leave it off. Slowly it will come down. Again you can go in for this next sitting. Repeated sitting helps. But you have to hit it hard on the thing. Right? See the dermabrasion. See, catch hold of the skin tightly. Put your 2 fingers. The 2 fingers are barriers. In between that only you are going to do a dermabrasion. Say you are going to do a dermabrasion in the around the eye. Close your hand, finger with your, close your eye with your finger, and then stretch the skin. In between the 2 fingers, do the dermabrasion. Otherwise, don't do. Within 2 fingers only dermabrasion. Otherwise, the dermabrader can enter your eye. Dermabrader can cut your nose. That will become horrible. You can't practice in that street next time. See this. See how hard I am. Without this hardness, the improvement won't be good. I think you are able to see that. 2 days steroids followed with hydroquinone. And when you induce a rejuvenation, normally we get improvement of 30%. Here too, Dr. Ratnavel is a rebellion, because in any dermabrasion, normally what we tell is, don't use isotretinoin before dermabrasion. Don't use isotretinoin before any other invasive procedure on face. But what I normally tell is, use isotretinoin. Be safe. Explain the patient. You will get a tremendous improvement. You know isotretinoin, vitamin A in alcohol form, is going to produce a very good amount of skin reepithelialization. A new skin is going to come out with the isotretinoin. Along with that, you are inducing a new skin. The added effects give a very good cosmetic result. So, put the patient on isotretinoin, 20 milligram daily night, go in for subcision, followed with dermabrasion, microdermabrasion or laser, whichever you prefer. Without isotretinoin, the result may be 50 to 60. With isotretinoin, the result will be around 90% improvement. Without isotretinoin, don't ever try any acne scar revision. See, after dermabrasion, on the table, apply human epidermal growth factor. Human epidermal growth factor, liberal application, close it. You can open it on the second day, followed with topical steroid for 2 days and hydroquinone for 15 days. So the first thing is human epidermal growth factor on the table. After that, followed with mometasone and hydroquinone afterwards. The patient has to be on sunscreener because you have put him on isotretinoin. Don't worry, don't ever think that isotretinoin is going to do any harm. It won't do any harm. If at all it's going to do any harm, it may produce a little amount of sun sensitivity. Don't worry about that sun sensitivity. We have to get results now. You want to cure the patient. You want to cure the patient. Be a little bit hard. Next one is derma roller. It's similar to your dermabrasion. The only thing, the needles are fine. The needles are very fine. Not more than 40 rolls in one area. See, this is the skin. Stretch it. Not more than 40 rolls in one area. You can count or you can just judge it. Not more than 40 rolls in one area. Because every cosmetic procedure has that. An erbium-YAG laser or fractional laser in a scar, not more than 4 shots in one area. This is not more than 40 roll on one area. We'll do a small punch elevation also. Punch I'll just show you how to go about with the punch elevation, normally which is not done nowadays. If it is a chickenpox scar, if they are so much worried, we can go in for a punch elevation, floating technique. But otherwise what happens is, if the donor graft is little bit bigger, the poke dot appearance itself will become a scar again. Again we have to dermabrate. So normally what I advise is, instead of going in for punch elevation or anything, subcision with isotretinoin, subcision with isotretinoin with dermabrasion, subcision with isotretinoin with laser will be of good help. But I will just show you for a demonstration purpose how to go about. 2 mm. 2 mm. Microderma. Matuda. It is. See the 2 mm graft? Punch. I'll take a small thing. See, See this? So this is a flotation technique. Again I told you, submerge it, healing, it will come up. Submerge it, on healing, it will come up. See the graph there? Right. So this is flotation. You can go for microdermabrasion also. Microdermabrasion with powder, microdermabrasion with diamond. Here too, not more than 40 shots in one area. Not more than 40 shots. It should be lesser than that. See this? This is aluminum powder. There should be a visible capillary bleed. Visible capillary bleed. Visible capillary bleed gives a very good effect, like derma roller. I think you are able to see that visible visible bleeding there. Saline. Not more than 40 shots in one area. That should be the dictum. In diode laser for hair removal, not more than 4 shots in one area. With erbium YAG, scar revision, not more than 4 shots in one spot. Not more than 4 shots in one spot. The next cosmetic topic which we are going to deal with is toothpaste. How to choose a good toothpaste? Toothpaste contains sodium fluoride. When the fluoride level is high, it's definitely going to produce complication. As you all know, fluorosis is one disorder which can damage the bones. 2, it contains preservatives like propylene glycol. That's also harmful. How to choose a good toothpaste? How to choose a good toothpaste? This is the toothpaste. Does not look like a toothpaste, but imagine it to be a toothpaste. There will be a small colored strip there. Colored strip there. This colored strip can be green, blue, red, black. Go see your toothpaste. Every toothpaste has this color. Green color indicates only naturals. Blue color indicates naturals plus medicines. Natural plus medicine. Here it is chemicals plus medicine, red color. Black, only chemicals. One is only natural, one is only chemical. Blue is natural plus medicine. This is chemical plus medicine. That's it. The difference is this only. But which will be safe? Green color will be very safe. Blue color, good. These two, bad. The whole cosmetic industry is flooded with this black colored toothpaste only. Black colored mark in the bottom of the toothpaste. See your toothpaste, you will judge it. Otherwise, I will get a toothpaste and I will show you. Now, come on, 6, 7, 6. This is 6. ID mole. ID mole, when a mole increases in size, increases in number, becomes painful, we have to be careful. When a mole increases in size, when a mole increases in number, when a mole becomes painful, we have to be worried. If it is not painful, if it is not increasing in size, if it is not increasing in number, just leave it out like that. Except for the cosmetic thing, we need not do anything. But if the patient needs a cosmetic one, so for a cosmetic purpose, if you are going to remove, the size of the mole is 3 mm. The size of the punch should be 4 mm. The size of the mole is 5 mm. The size of the punch should be 6 mm. The size of the mole is 6 mm. The size of the punch should be 7 mm. So, it should be definitely bigger than the mole size. You cut exactly, without your knowledge, you leave out little amount of tissue, again it's going to regrow. So be careful about it. The size of the punch, the size of the mole, the size of the punch should be at least 1 mm more than the size of the mole. That is the dictum, 1. 2, like a punch biopsy, go until the depth, cut the ID mole, get a fresh bleed, everything is over. You don't get a fresh bleed, you don't get a bout of bleed, you are not cut it properly. So 1, size, 2, the length of the cut. Suture. Right. See this? ID mole here. Put a suture. See that? So I have gone unto the fat. See that bleed? See that fresh bleed? This should be the fresh bout of bleed. See this? See the fresh amount of bleed? See the graft also. Right? Now in the cosmetic topics, we will go in for hair dye, commonly used again. Hair dyes with ammonia can produce folliculitis and irritant dermatitis. Hair dye with PPD, paraphenylene diamine, more than 2.5% can produce nephrotoxicity. Hair dye should not be applied in the afternoons. Hair dye should not be applied to the hair root. So these are all the 4 conditions. Not to be applied to the hair root, not to be applied in afternoons, apply in the evening or apply at night, the PPD level in any hair dye, go see the hair dye cover. The PPD amount is to be less than 2.5%. It's a good hair dye. Ammonia free, it's a very good hair dye. After application, some hair dye needs only 5 minutes, some hair dye needs 30 minutes. Instant hair dyes, 1 minute hair dyes, 5-minute hair dyes, don't ever do, don't ever try. They are all very, very harmful. Don't ever try, don't ever do. So hair dyes not to be applied to the root, not to be applied in afternoon, ammonia free, PPD less than 2.5%. PPD, as you know, is used as a color developer for photographs. Same PPD will produce lichenoid dermatitis. It can produce even nephrotoxicity. Cosmetics as a whole, I told you 4 P's: phthalates, propylene glycol, parabens, polymethyl methacrylate. These 4 things are very, 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 very harmful. Phthalates can produce endocrinological damage. It can produce male infertility. It can be cancerous. Parabens can produce endocrinological disturbances. Propylene glycol can produce endocrinological disturbances. Polymethyl methacrylate can produce nephrotoxicity. Formalin, as you know, formalin fumes can be so harmful, like your cigarette smoke. People standing inside formalin fumes can end up with lung carcinoma. So we surgeons, we use a lot of formalin. See, I am doing these surgeries in a formalized theatre only. Yesterday night everything was formalized. Formalin fumes can produce lung carcinoma. So avoid that also. Next cosmetics will be nail polish. I will tell you a little about nail polish, because nail polish every girl is wearing. They eat that nail polish also, for that matter. Along with food, they eat little amount of nail polish also. Next one will be nail polish. Before that, we'll do a lipoma surgery. In the case, Jana. Lipoma, smaller lipoma. Camera marikidhu. Ingitu vaanga idri. Ingitu vandrunga. Smaller lipoma, we can do phosphatidylcholine. Phosphatidylcholine is a wonder drug, but along with deoxycholate only, it produces wonders. A plain phosphatidylcholine in any cellulite, in any lipoma, in striae, in abdominal obesity, does not produce good effects. With deoxycholate, which will act like a detergent, it will not allow this phosphatidylcholine to get diluted. So this phosphatidylcholine with deoxycholate can be useful in abdominal obesity, can be useful in lipoma, can be useful in striae gravidorum, can be useful in cellulite. Not more than 10 ml in one lipoma, not more than 40 ml in one abdominal obesity, not more than 30 ml in one cellulite. See, not more than 10 ml in one lipoma, not more than 30 ml in 1 cellulite, not more than 20 ml in 1 gynecomastia, not more than 40 ml in 1 abdominal obesity. You start a treatment of abdominal obesity. Abdominal obesity, we have lipolaser, we have cool sculpting, we have cavitation therapy, we have radiofrequency tightening, but with phosphatidylcholine only, it produces good results. This is my practical experience. I may deviate from normal subject. As I told you, I am a rebellion. You should have seen people asking psoriatic patients to take methotrexate and ask them to go into PUA chambers. We don't know which works. We don't know whether PUA chamber or it's methotrexate. But combination of both normally works good. Same way in obesity, any obesity management, first inject phosphatidylcholine, then go in for any procedure. Phosphatidylcholine is going to go inside a fat cell. It's going to produce a mechanical damage to the cell wall. The fat is going to get extruded. 10 ml in 1 lipoma, 20 ml in 1 breast gynecomastia, 30 ml in 1 cellulite, 40 ml in 1 abdominal obesity. Again, if you want to repeat, give a gap of at least 1 week to 10 days. Without that, it produces a very stingy pain. So I'm just going to inject the phosphatidylcholine, see for it. We can do it for gynecomastia, we can do it for lipoma, we can do it for striae. Striae, we can inject liberal quantities up to around 40 mm. Up to 40 mm in the sense, if this is going to be the striae, if this is full of striae, divide it into quadrants, divide the dosage so that you inject 40 ml. 40 ml in 1 striae, 40 ml in 1 abdomen, 30 ml in 1 cellulite, 20 ml in 1 gynecomastia, 10 ml in 1 lipoma. See how I inject that. Very simple like that. Go just perpendicular to it, inject it. You can see little amount of swelling over there. The swelling indicates that the solution is going in. Don't go below the lipoma. Don't go superficial to the lipoma. Enter the lipoma, inject it, leave it off. Just put a pressure dressing. That's it. This is a simple one. If you don't have phosphatidylcholine, this will be another simple one. See a lipoma. See. Right. See that? It's so simple. Very simple procedure. Here, before anesthetizing a lipomatous lesion, first put a small mark over the maximum prominent area. Maximum prominent area, because some lesions can be beaded. Maximum prominent area, mark it, then anesthetize, because if you anesthetize before marking, the lipoma can get submerged. You know, it's something like a movement tumor. So, before anesthetizing, mark the lesion, anesthetize, remove it. Paste. See the paste. This is blue color. This is black color. People tell that you will get lots of girlfriends and you will get lot of boyfriends if you use this one. See this. This is black, full of chemicals. This is red, chemicals and medicine. Blue, this is natural and medicine. But if you can opt for a green one, it will be the best paste. See these pastes. Go to your house and then decide. medical cosmetics. What to use, what not to use, how to use it in a sincere manner, how to see that we don't end up with any complication. This is the main thing, main thing, main thing. Good. Now, I told you about nail polish. Nail polish, I told you that every female eats in and around 1.5 kgs of lipstick in her total life period. Same way, even though you think that the nail polish has stuck onto your nails, you eat a liberal amount of nail polish throughout your career. So be careful how to see that it does not have any untoward chemical. What are the untoward chemicals there? One is formalin, toluene, phthalates. Formalin, toluene, phthalates. Phthalates, male infertility. You put a nail polish, you feed your husband, you will make him sterile, you will make him impotent. One, this is not 1 day or 2 days, but no female nowadays feed any male for that matter, but sometimes you feed children with a nail polish, you give acidic foods, definitely a little amount of nail polish will get added to your food. Phthalate will produce male infertility. So, if you feed a female baby, doesn't matter. Male baby, don't feed with the nail polish. Then toluene. Toluene, endocrinological problems. It can produce thyroid and parathyroid problems. Formalin, I told you it can produce lung cancer. So the three things which are to be avoided here is this one. The other main one is polymethyl methacrylate. This is a dye. I told you, dye which comes in the name of number should be avoided. You see a nail polish, you see any dye, numbered dye, you have to avoid it. Numbered dye will produce problems. All dyes have to get filtered through the kidney. That will produce a kidney damage later on. As I told you, PPD in a hair dye is going to produce a nephrotoxicity. Same way, polymethyl methacrylate in a nail polish is going to produce a damage. So nail polish, apply, wash it after a good occasion. Don't leave it for 7 days, 8 days, 10 days. That is not the way to be applied. Apply it, leave it for 3 hours, 4 hours, leave it for 1 day, wash it. You poison yourself, you poison others also. So, don't ever do that. You may tell that I am using a very good brand. You can use a very good brand, see these chemicals, go and see your nail polish. You will find out that at least 2 to 3 chemicals of which I have written will be present there. That is to be avoided. Then we will go about the baby products. Baby products, when a baby is born in a hospital, everybody, whoever comes to the hospital, comes with a big baggage. Everybody comes with a big baggage, full of cosmetic products, powder, lotion, creams, shampoos. What I advise is, no baby cosmetic products for at least 6 months. No baby cosmetic products for at least a period of 6 months. Don't spoil the children. I will tell you a finer point here. See, soaps containing triclosan. Earlier it was used in baby soaps. Now it's used in adult soaps also, telling that it will produce a very good amount of skin rejuvenation. But unfortunately, what is the effect of triclosan? It is going to be an antibacterial, but acts as an antibacterial on the skin, but kills your own flora. When it kills your own flora, you are going to end up with other infections, other foreign body infection. You are going to use it in a good sense, but the flora is getting affected. When the flora is affected, everything is gone. So, triclosan in a soap, no, 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 especially in children. In children, no cosmetic products for at least a period of 6 months, but nobody will hear. Nobody on earth will hear. I will tell you few things. See, powder. Powder contains magnesia, silica, contain little amount of aluminum powder also. Lot of use of powder can you end up with dark granuloma. A child is breathing through the skin. The skin surface is nearly 2/3 in a child. 1/3 is the organs, 2/3 is the skin in a child. In an adult, the skin weighs around 5.5 kgs, of which 2/3 is water. In an adult, the length of the skin is 22 square feet. In a child, it's 2/3 of the whole body surface. 1/3 is only abdomen. So 1/3 is only the organs. When I tell it to be 2/3, your skin is breathing. So whatever you apply, 60% is going to get absorbed. When I tell 60% is going to get absorbed, any cosmetic thing you apply is going to produce complications. So how to avoid it? Don't use. No baby lotion, no baby shampoo, no baby soap, nothing, nothing, nothing. If at all you want to have a soap, avoid a soap which has triclosan, because all your baby soaps have triclosan. You are going to induce bacterial resistance, you are going to induce other infections. Without triclosan, use, but immediately wash it. Now, chickenpox scar, punch elevation. What I am going to do is just remove the scar and put a suture. This will be easy way. I showed you one flotation technique. This is just going to be removal of the scar with a punch and put a small suture. That's it. See that? I think this is you are able to see the scar. A small punch there. It has to be very superficial. Cut it and put a suture. Any chickenpox scar, this will be the best method. Instead of this, you go for any other laser correction, this correction, that correction, nothing is going to work. This will be the best form of treatment. The only thing, it will leave out a linear mark, just approximation of the skin, just approximation of the skin, even avoids that. You tighten it, you tighten the suture, you are going to leave out a mark. See here, this is a chickenpox. You remove the chickenpox lesion, don't tighten it, just approximation of the skin. Put a suture, that's it. Just approximation, near normal results. Normally it does not produce any scarring. After that you can apply epidermal growth factor. We in our department, any invasive procedure we do, we use epidermal growth factor. Human epidermal growth factor. This human epidermal growth factor, one, heals the lesion fastly, two, the results are good. the results are good. Continuous usage for at least period of 1 month, what we have seen is, even if a patient is keloidal in nature, it's very minimal. So hypertrophic skin lesion or keloidal tendency normally gets minimized with their human epidermal growth factor. Any scar revision, anything where you remove the skin, apply human epidermal growth factor, continue it for 15 days. You will get good results. It comes in the name of region D. Region D, ma? Region D. This is region D, human epidermal growth factor. Any trauma, you do a dermabrasion, you do a microdermabrasion, you remove the epidermis, apply this human epidermal growth factor for 15 days, there will be definite help. I was telling you about the baby products. Baby products promote that it is no tear formula. It also contains sodium lauryl sulfate. Then what is the use of that no tear formula? It may not irritate, but if it is going to produce complications of sodium lauryl sulfate, which is folliculitis of the scalp, which is thinning of the hair, then what is the use of a baby shampoo? Because now you ask every girl, what shampoo you are using? I am using baby shampoo. I am a baby. I want to be a baby always. You should know that all baby products are also carcinogenic, not good for the skin. Can we avoid cosmetics? No, we can't avoid. We are living in a cosmetic world. We should be presentable to others, but use it in a sensible way. So no baby products for at least a period of 6 months in children. After that, enjoy. Can I guess? Right. Now, I showed you one case of scar revision by just cutting the scar and suturing it. Now we are going to do an autologous fat transplant. How do we do it? Take the fat from any area. I am taking from the buttocks. You can take it from any area. Put it into a test tube. You take 20 grams of fat, put it into a test tube. You add 5 ml of saline. It's to be 1/4. 20 ml of fat, 5 ml of saline. 10 gram of fat, you have to take only 2.5 ml of saline. Put it into a centrifuge, 3000 RPM, leave it for 10 minutes. Take the fat outside. What is present in the fluid is the fat cells which have broken out of the fat cell. When you put it in the centrifuge, the fat cell membrane is broken out, the fat is extruded, the fat goes inside the saline, which you can use it as a filler. We have artificial fillers, we have hyaluronic acid fillers, we have acrylate fillers, we have bovine collagen fillers, we have lots and lots of fillers. What is the safest filler? Will be hyaluronic acid. But my experience, radius will be the best filler. Radius is acrylate crystals. Radius will stand for 3 to 5 years. All other fillers will last for 6 months to 1 year. I will show you how to remove the fat now. Blade. See, fat see, forceps. No. ஏய் பேசிகிட்டு இருக்க வந்தீங்க. ஒன்றும் எடுக்கல. ஏன் சி இல்லை பீட்டாடின் இல்லை. பேசிக்கிட்டு இருக்கிறது தான் லாய்க்கலாம். இல்லைங்கம்மா பீட்டாடின்மா உங்களை கிட்டது இன்னதுக்கும் பிரயோஜனம் இல்லைம்மா எல்லாம். See how I am cutting it. See the fat? See the fat? So this should be around 20 grams. 20 grams, 4 ml. 10 grams of fat, 2.5 ml of saline. Instead of going in for an artificial fillers, this is very simple. Very simple, within 15 minutes everything will be over. So, my advice will be, use a natural filler always, because the results will be very nice. Say in a depressed scar, say in a morphe, a depressed morphe, if it hatches the blood properly, the results will be nice. Sometimes we end up with failure. I had one case which was referred from Nagarcoil GH, a facial hemiatrophy. I will show you the slide, a facial hemiatrophy. We transplanted this fat onto that area. First sitting, we got a response of around 20 to 30%. Second sitting, we got a response around 30 to 40%. Again it failed. It went on to the normal position. Third sitting, again there was an improvement. The failure is due to the blood supply there. The fat which you are transplanting, which you are transplanting should take up the blood properly. See this, I put the fat there. வேலை பாரு. C must be 10 gram. Add 2.5 ml of saline. Put it into a centrifuge, right? With the artificial fillers, one I told you, hyaluronic acid only has a life of 6 months to 1 year. All other fillers, it may last to 3 years to 5 years with radius. But radius is harmful. Anything whichever is temporary in cosmetology is good. Anything which is permanent in cosmetology may end up with side effects. All cosmetic procedures are temporary. You are temporary, I am temporary. All cosmetic procedures are also temporary. Botox, 6 months. Fillers, 6 months. Dermabrasion, microdermabrasion, scar revision, everything is temporary. Laser hair removal, temporary. Because we have to go in for a laser hair removal throughout life. It's not going to be a permanent phenomenon. So, what we have to do? We have to opt for a temporary process only. Permanent process will definitely, if at all, if it ends up with a complication, that becomes a problem. Something like tattoo granuloma. You are to inject the tattoo midway between the epidermis and dermis. If you inject it inside, it's going to become a granuloma. If you inject it outside, it's going to get extruded out. Extruded out, again you can do. So underdoing is better than overdoing. Overdo, you are going to end up with granuloma, again we have to remove it. How to remove a tattoo granuloma? Now I am just telling the complications of the procedures. Tattoo granuloma, how are you going to remove? One, we can inject intralesional steroids. We can inject intralesional steroids into the granuloma. 1. 2, we can dermabrate the lesion. We can wash it out. We can dermabrate, go deeper, we will be able to see the pigments. Red pigments, green pigments, blue pigments, every pigment will be there. We can wash it out. Apply a topical steroid, everything is going to come down. A smaller granuloma, just inject steroids.